video, we'll go over all the resource books that I use in my practice as a family nurse practitioner all the time. These would be ideal to acquire anytime within your clinicals, if you're in school, or after you've graduated, just to kind of beef up your practice a little bit. They can also be something you're on the lookout for if you're in school and you're like, oh, this is on my required reading list. You could know maybe you want to consider buying that one rather than renting it and ditching it at the end of the semester. In the video, I'll give you a brief description of the book and how I utilize it in my practice. I should note I work in family medicine, primary care, so that is the target of most of these books. So if that's not your focus, some of these will be helpful and they'll kind of become obvious as you watch it. I would say about half, and the other half you'll be like, I never see that. I'm not here for it. So just skip ahead a little. If you're new here, welcome. I'm Liz, and like I said, I'm a family nurse practitioner, and I just hit the 1-year mark in my practice. And that first year is always a huge learning curve. So I've relied on a lot of these books heavily, and they've been such a lifesaver. So I thought I would share them with you. So I thought we would go in order of things I use absolutely all the time. So like most used to least frequently used, and I've eliminated anything that I don't use at least once in a 2-week period. So I do have a couple more resources that are just like here and there, super spotty, but I didn't include those because I want this to be just stuff I use absolutely all the time. I will also have links to all of the material that I talk about in the video down in the description box below, so you don't have to worry about taking notes. You can just like sit down, relax, and chill. This isn't class, so just try to enjoy, all right? You can do it. First, I do not know how I survived without this book. Well, I do, but I was just lost and confused a lot of the times. Clinician's Guide to Laboratory Medicine. This book is all about labs. What do you do when they come back high? What is too high? What if it's too low? How do I know if it's like low or like low, like, oh my gosh, I'm panicking low. It's filled with flow charts that help you decide how to proceed based on this super wacky potassium lab you just got back, or it'll help you figure out what on earth type of anemia we're dealing with here. I use this almost every day in my practice, just to kind of verify, you know, when labs come back and you're reviewing them, am I really worried? Do we need to do something about this today, or can this wait till next time? And what's my plan going forward? It's an absolute gem. I love it. Highly recommend. If you get nothing else out of this video, I hope you know about this book because I love it that much. Next, the EMRA Antibiotic Guide. Also a gem. This lists the first, second, third, and fourth line antibiotics that you can use when treating infectious disease. It's insanely easy to navigate because it goes by body system. So there's a section for skin, and then HEENT, and then gut. It includes the dosing and the timing of how to take it, any black box warnings they throw in there for you. It has little notes for if the person is allergic to penicillin, like what should you give instead, or if your resistance is really high in this area to this, maybe you should try this. And it tells you things like use this in worst case scenario only. So it kind of helps you figure out what antibiotic you want to give these people depending on their specific situation. And in the very back of the book, it has all these nice charts detailing if the antibiotics are good against gram-positive, gram-negative, both, what the cross-sensitivity of those antibiotics are. Can pregnant humans take this antibiotic? Mine, as you can see, is the older version. I plan on updating this every 2 years, so I'm going to get one actually at the end of this year, just to stay up to date with my practice. Highly, highly recommend this one. The thing I use next most often, and this is gonna vary hugely based on if you see a big women's health population. I do tend to see a lot of women's health, so I use this all the time. And this is the Contraception Pocket Card, and it is a lifesaver. I feel like I say that about everything, but that's why they're on this list, because they save me. And it saves me because if you have ever tried to order birth control, you know it's kind of like an overwhelming nightmare. There's about a million different choices and they all sound very similar and you're like, how on earth? Where do I even pick? This gives you the names listed out of a ton of different birth controls, and they're categorized by their progesterone component. So you can see ones that are similar, you know, that have the exact same active ingredients, or how much, and it also lists it out by how much estrogen it has in it. So that can give you an idea of like what's in the same family, or if you want to tweak the type of progesterone or the amount of estrogen, you could just look under the chart and say like, oh, I want one with this type of progesterone and this much estrogen. I want, oh, and here's a list of all the ones I can choose from. It also gives you helpful tidbits on how to tweak the medication based on some complaints the patient might have. So say you're prescribing something, birth control, and you also want it to help with acne. It'll tell you the progesterone that is the best for that. Or like maybe if they started the birth control, but now they're having breakthrough bleeding, it'll tell you like, hey, you might want to pick one with a little bit more estrogen, and it gives you the list of all of those. It also lists the different types of safety warnings that come with the different types of birth control. So like combined oral contraception, hormonal hormonal IUD, copper IUD, anything that you're injecting or an implant. It goes through all the different safety and risk factors, and you can look it up by like, the patient's age, their medical diagnosis. So if you're wondering like, can my diabetic who smokes, who's 32, what's the best for her? It has all those charts. That way you can kind of see like what's the safest option for you and what is absolutely like a big no, we're not going there. So if you see women's health patients, this is huge, because let me tell you, when I first got into practice and I was independently prescribing birth control, I was like, I don't know, like, and there's no one like good go-to like, oh yeah, just take this one. So this has been really, really helpful in helping me figure out how to navigate the sea of the 8 million birth controls that there are out there. Next on my list is clinical dermatology, because dermatology and I are not friends. Are you friends? Can you help me? Because holy cow, I hate derm. And I feel like the feeling is mutual, like the universe knows that I hate derm, so it sends me all the derm. So if you need help with derm, this book is great. Now I will say, it is very gross. There are a lot of pictures. You should not leave this out laying around for potential housed guests or children to see, or queasy husbands. It will shock them. Appetites will be ruined. Squabbles may occur. I know this from experience, and I apologize to anyone I've ever traumatized when this book was just laying out in the open. Did I mention the pictures are in color? It adds to the experience. But the beauty of having so many pictures and detail in this book is when your patient comes in with this weird skin thing you're not super duper familiar with, you can go through the book. It's also categorized by type of skin eruption. So like pustules, is this a hair thing? Is this a nails thing? Does it itch? It goes through all of that kind of by category, and it has pictures of all the stuff. So you can kind of just flip through it and be like, oh yes, it looks exactly like that. Perfect. Next to the pictures, it always gives you a description of the potential disease process, as well as other differential diagnoses that it would like you to consider, and then a basic treatment plan. I usually go somewhere else and just verify the treatment plan, but I use it primarily for figuring out this kind of looks like this, and then looking at the differentials to see like, or could it be this, going and checking out that, and it kind of guides my approach to a lot of these odd skin things that show up, because you're going to have like at least every other day that you're going to see on your schedule the primary complaint of rash, and you're just going to want to go hide under your desk. And this helps you tackle that with a little bit more confidence. I'm not saying it fixes the problem, but it does help. All right, next. Do you see children in your clinical practice or in your actual practice? If you do, you need this book. Bright Futures, I have the handbook. They also have a full-length version of the book. I don't have that one. The handbook served me really well so far. It is a phenomenal pediatric reference book of preventative health. This is like the holy grail book of pediatric well visits. It goes through what screenings you should be doing, like lead, iron, all of that stuff, and at what age you should be doing them, what vaccines they should be getting, how to catch them up if they're behind, what developmental milestones they should be reaching, what questions to ask them maybe about like school and their friends, when do we start talking about like drugs and all of that type of stuff, and any anticipatory guidance you should be offering them or the parent regarding the stage to come. I always review it before I go into the room and like make a little template on my computer for the specific age that I'm seeing. Excellent little resource. Speaking of children, I reference this book when I'm working with children and adolescents. I do see them, but they are not who I see the most. So sometimes if I have a pediatric patient who's coming in with a question or a concern or a complaint, and I just want to double check and kind of see like, am I probably on the right track with this? I will use this book as a reference. It's pediatric primary care. It's a textbook you probably had in school if you are in an FNP track. Again, this is one I would just consider keeping maybe rather than letting go, even though I know it was like super expensive. It's helped me in different assessments that I've had to do, and it's been a good checking point when I'm just like, I am pretty sure that this is kind of what this is indicating, but let's just double check. It also has some helpful things in there with like growth and development. Would I necessarily go out and buy this if I didn't already have it from school? No, probably not. I think the information could be found out there elsewhere, but if you already have it, it's one I would probably hang on to, or if you find it like super cheap somewhere, it's helpful enough that it's good to hold on to, or like I said, buy it super cheap. Next on our list is a health assessment book. This is the one that I used, but it doesn't have to be this one. Again, if you have gone through FNP school, you are going to have had a health assessment book. I like this one that we had because it was categorized by chief complaint. So if your patient's coming in with ankle pain, you can look up ankle pain in the book, and it'll give you kind of the questions you should be asking in your HPI that are sort of guided, as well as the physical exam components you're going to want to do, and it'll give you reminders of how to do all those tests, because I feel like in medicine we have all sorts of weird signs and tests that we do, and they all have really odd names from whoever developed them, and you can never remember like what that one means. Like, does that mean I have appendicitis or I do not have an ACL anymore? Kind of unsure, don't know the names. This will guide you and be like, you want to do these tests, this is how you do them, and there's like pictures in the book of how to do it, as well as some differential diagnoses based on the findings that you get in your physical exam and your HPI. This book has been particularly helpful when I'm able to look ahead and see my patient schedule and see like, ooh, you're coming in for this acute complaint. Let me just review really quick how I work up a knee or right upper quadrant pain specifically, so that I can go into the room feeling a little bit more prepared than if I had just gone in, you know, blindly and then had to sort of try to recall that from way back when. If you are in clinical or you are newer in your practice and you have trouble coming up with differential diagnoses, this next one may be helpful for you. Current medical diagnosis and treatment. I obviously have an older version. This is from when I was in school. I am going to actually buy the newer one soon. Again, like with the antibiotic guide, every few years I'll probably refresh it until I feel like I don't maybe need it quite as much anymore. And if you are going to buy it, I would probably recommend buying like 1 year older, because these books are more expensive. But if you buy the 1 year behind, it's gonna have mostly the same information. You're probably gonna verify treatment plans with some kind of other evidence-based material anyway, like up to date or some kind of journal article. So you're mostly using this for the differentials, and a year older version is totally fine. This is just kind of to generally point you in the right direction and give you some guidance. And there were many points in the last year where I used this for guidance, because I was kind of just, you gather all this data and then you were kind of like, I just need like help with a direction, and this gives you that. So this book is categorized by complaint as well. Are you noticing a pattern here? I feel like most of these books are categorized by complaint, which is easy and makes our lives simple. So if, let's say your patient comes in with ankle swelling, it'll give you some different, let's say your patient comes in with ankle swelling. It'll give you some different differentials of like, these are the things that usually cause ankle swelling. Here's some stuff you want to make sure, like red flags you definitely want to avoid. Here's some differentials you can kind of work up, and maybe some tests and exams that you can dive into. This is similar to the one we just talked about, the assessment book. However, this is much more detailed and doesn't give you the instructions on how to do the physical exam nearly as much. This is much more like, check these out, and then you have to go figure out how to check them out, if that makes sense. The next item on the list isn't technically a book, but it's been very, very helpful to me. I use it almost every day. It's my NP reference binder. So I actually put this together. It's a combination of notes that I've made, as well as handouts I've made, patient education sheets, some links to journal articles that I use all the time to guide my practice, like comparisons of steroid creams, things like that. Then it includes other guidelines like you know, hypertension management, the latest diabetes recommendations from the ADA. I just pretty much compiled all the resources I use and reference all the time in primary care, put them in a binder, and then I update it every few months. It is obviously tailored towards primary care because that's where I work, but if that's something that sounds interesting to you, I'll leave a link to it down below if you want to check it out. But whether you use this one or make one of your own, this is something I would really recommend, is just gathering all your information so you can physically flip through it, whether it's stuff that you printed from up to date maybe, to just kind of have on hand. Sometimes it's nice and easy to just have a physical copy you can flip through real quick and be like, okay, perfect, got it, let's go. And you can tailor it, like I said, to your practice and what you see the most. Next, also not a book, but something that is really, really helpful as a reference is an alphabetized notebook that has information that is practice specific to you. So this isn't the whole guideline document like we just talked about. That's in the previous binder. This is just alphabetized. I have a whole video on how I use this notebook in practice. If you're interested, I will leave it linked down below. This is more like, oh, patients coming in with scalp itchiness. What's my go-to treatment for scalp itchiness? Go to scalp itchiness under S. And then I have my like top 3 things I usually use for that. So this is like super quick, something I can look at, you know, when I'm ordering a foot x-ray, exactly what x-ray is it in my computer system? What lab do I order for this specific thing? What's the CPT code for this type of injection that I tend to give all the time? Things like that are very specific to you that you need to reference really quick, but your brain is too full and it can't hold all that information. At least mine is. It just can't hold anymore. So I just have to write it down. who you like to refer to. I have a huge list of who I like to refer to. Anything like that, highly recommend, so that you don't have to worry about keeping it in your brain and you don't have like note cards and notes all over your desk. This kind of is just like your work brain in a little binder. And that's it, guys. Those are my most used resources as a family nurse practitioner. Again, all the items we talked about will be listed below. If this video was helpful, some others you may be particularly interested in would be my list of apps I use in primary care to make my practice and life easier, as well as podcasts I listen to stay up to date with practice. I will leave both of those videos linked in the description box below. And to keep seeing videos like this, consider subscribing. I'd love to have you. I make content videos like this on Tuesdays about usually nursing and NP things. And on Saturdays, I have a weekly vlog documenting my life as a family nurse practitioner in and out of work. Also head over to Instagram, where I post lots of fun things about what I'm seeing at work. I try to post something that I'm learning every day. And then, you know, the usual dog, my children, all that fun stuff. We always have a question of the day, which is, what is your favorite resource that you use at work? I don't care where you work. You could be a barista or an airplane pilot. What is your favorite resource that you use? Mine is that lab book, because holy cow, I just love that thing. And if you check it out, I hope you will too. Hope you have a fabulous rest of your day, and I will see you again next time. Bye.